Well, certainly as you look at the impact of past guidelines from the Academy, you can see some impact in terms of choices made by providers and patients. And so it's very important to get that information out so that providers working with their patients can make the best choice possible in terms of care.
Providers are utilizing practice guidelines. So, for example, in our recently released clavicle clinical practice guidelines, some of the evidence there can help provide with the appropriate evidence in clinical decision making to see, with regard to the patient in front of them, whether they should pursue surgical or non-surgical treatment, or even focus a little more on what type of treatment, whether what type of plating techniques or intramedullary techniques. And so we provide some of that evidence at the provider level. At a system level, I've seen the clinical practice guidelines used to establish best practices and policy as it pertains to clinical processes throughout the system. And so another recent example of that is the system I work in using the clinical practice guidelines for ACL, guiding some of the clinical processes and patient care processes from a system perspective to try to establish that as best practice. So we see the clinical practice guidelines being used, I think, at the bedside, but also more broadly across the healthcare spectrum.